Okay, so today we're going to be talking about bathing and bed making skills. After completing this practicum, you should be able to describe the various types of baths, give a complete bed bath, and as you can see, you just go ahead and read down this thing. I'm not going to read everything to you. You should read chapter 31 in your textbook, as well as make sure you know how to do the watch the video for the hygiene section. So I'll demonstrate it on this video, and then when you come to class on Wednesday, I won't be getting up and demonstrating. You'll actually just get into groups, and all of you guys will all make baths, all right? To do baths and make a bed, an occupied bed, I should say. All right, so let me switch this computer over. So basically, there's some hygiene guidelines to start with. Prior to starting a bath, offer the patient a bedpan or urinal. Inevitably, once they get their hands in the warm water, they all have to go to the bathroom. So make sure you want to do that ahead of time. Get that out of the way, and then you can have the person can have a nice relaxing bath. All right. Again, provide privacy. That's pretty important. They're taking a bath, so you want to make sure to provide privacy. Again, what we talked about, people looking down the halls. And use a bath blanket for warmth. Remember, a lot of times it might be hard for them to hold their temperature because of some illness or whatever. But the thing is, you want to make sure that you provide a bath blanket for warmth, so they're covered up and they're only exposing what you need to expose at that time. And you want to ensure the temperature is comfortable and safe, just like you would for, like if you were giving your child a bath at home, or anyone. Now think about it. It may be too hot or too cold. So just check it on the inside of your forearm, just like you would for like a child. And that becomes especially important. Think about if you had a patient who was diabetic, and they don't have the sensation in their feet or their fingers and all that, and then the water's too warm and you accidentally, burn them. So you want to make sure that water temperature is comfortable and safe. And then hygiene guidelines. Use a clean washcloth after dirty areas are clean and as needed. So once you don't be afraid if you need to use washcloth, more than one washcloth, which you will, make sure you get rid of the other washcloth. So I'm not going to go washing my armpits and now go wash my legs. So think about, if it's dirty, get rid of it. And also when you think about that, think about which areas you wash first. I don't mean to be gross, but are you going to wash your perineal area and then come and wash your face? So think about that when you actually start to, do the bed bath. So some procedural examples to keep in mind. Wipe from the inner to the outer part of the eye first. So you would take your washcloth, and before you put soap on it, you would have the water, and you're going from the inner part of the inner canthus to the outer. So you would clean like this, and then you would get a different area of the washcloth to do again. So you aren't going to be you don't want to bring germs back into that lacrimal duct. All right. So use a towel and bath blanket to cover the patient. Only expose the area cleaning. Only basically what that's saying is cover everything else up. Only expose the area that needs to be cleaned at that time. It helps keep them warm, but it also thinks about privacy and their dignity. All right. Pay attention to any folds in the skin and observe for redness or skin breakdown. A bath is a great time to do actually some skin assessments. So while you're doing the bath, think about, not everybody is like a perfect mannequin or a perfect, model situation like they may show in the videos. People have areas of skin that touch other areas of skin from excess adipose tissue. And so when that skin lays on top of skin, like in pendulous stomachs or breast tissue, what happens underneath those tissue areas? They're dark, they're moist. What do you think? Yeah, some kind of yeast. So you get yeasty areas. So you make sure that when you wash that, you clean that area and you dry it really well. All right? All right. So, and it's like I said, it's a great area, a great time to actually really do a great skin assessment on that patient. And then when cleaning the perineal region, remember to always proceed from the least contaminated to the most contaminated, using a clean portion of the washcloth for each stroke. Just like your mom taught you, you clean from the front to the back, right? So when you're wiping, the same thing when you're cleaning. And I'm going to show you a better picture in a second. All right, so you're providing perineal care. What I'm talking about with that is, for one thing, when you're providing perineal care, the patient's not sitting up in the bed while you're doing this. If the patient needs you to provide their perineal care, how would you position a female patient? You want to think about putting them in dorsal recumbent position. And if you're not sure what that means, I want you to make sure you look that up in the book, because they're laying back, their legs are up, their feet are on the bed, so that you can get a good view. Otherwise, where is the perineum in the bed if they're just sitting up? You can't really reach it. You can't see what's going on, can you? So you have them in the dorsal recumbent position, and then your gloves are on, of course. And you want to make sure you're cleaning from top to bottom, so from front to back, because you don't want to be cleaning this way upward, because what happens with the germs that are in the rectum, the stool area? There could be germs here. Where's it going? What are you going to get? A UTI. So you want to clean down to a different area of the cloth, down a different area of the cloth, and you clean from the cleanest to the dirtiest. So I'm not going to go clean over here and then go clean up here, right? Okay. And then for the male, how do you do that? Now, if they have some foreskin, you have to pull that back. But so you want to do the same thing. You want to clean in one of the glands of the penis first, and then to the down the shaft. So I would do one area of the washcloth, and then I would take another area of the washcloth and go downward. So what's the proper method to clean dentures? So you notice how what they have in this cloth, they have a washcloth in the sink. And why do we do that? Well, we do that, frankly, because dentures are expensive, and if you drop them, if you drop them into the sink, it's going to be expensive, and they're going to crack. And not only about the cost, but a lot of times, no, I'm just videotaping it. A lot of times about the cost, it's not just the cost, but sometimes it takes a lot just to get these dentures fitted properly. So if you bust somebody's dentures, they're really not happy about that. So usually you put a washcloth in the sink, and you just take them out and brush them just like you would normally brush regular teeth. You can also put them in a cup overnight and put them in a preparation that's made, like they have little things that fizz and cleans too. But don't be using hydrogen peroxide, things like that. That actually weakens it, so you don't want to do that. You can use a half and half strength of mouthwash, but they do make preparations for that. But as simple as taking them out and brushing their teeth. You may need to, if you have a hard time getting them out and they can't get out, take a 4x4 with your gloved hand, and then you kind of take them out and you kind of press and you can pop those out. What about giving a shampoo? Now, that's wonderful. You can actually shampoo their head. They have this little tray. What you can't see is there's a little tray that goes in here. You want to make sure you have something to collect the water if you're actually doing this. So you would wash their hair, especially if it's really dirty, and comb it and clean it. So you can also use, they have shampoos in a bag. And I can tell you, I've been in the hospital, and one of the most irritating things for me was when my hair was just disgustingly gross and greasy, and I couldn't get out of bed because I was on bed rest, and I couldn't get it shampooed. I couldn't wash it. When someone put and gave me a shampoo, it was just the most wonderful feeling in the world. So it's really nice if you can actually do that for them ahead of time, comb their hair, get that clean. Obviously you have to if there's blood or anything like that in it, but just cleaning someone's hair can make them feel a world of difference. Think about how you feel when you've had your shower, when you've taken care of your daily needs. If you can help someone else to feel that way, it really does help a person to feel like they're coming around, that they're getting better. When you start to look better, you feel better. So if you can help them clean. Do you notice how they also have in this picture, they have this padded, because there's a lot of water, so you don't want to have to re-clean everything. They don't want to be soaking wet, so you make sure you really pad things well. If I was going to do a wash their hair, I would probably do that right before I changed the bed. I wouldn't do that after I did the bed. So I would think about, what is the chances of getting the bed wet, all those things. All right. What about contact lenses? Do you need to take a person's contact lenses out if they're not able to take out their own contact lenses? So how do you take out contact lenses? If they're soft, if you've ever had soft contact lenses, if you put a little bit of saline in the eye, you drop a little saline, it can move around a little bit, because when they're dry, they seem to stick. So if you put a little saline drops in their eyes, you can move it. And then the best way that I do is I take it on the eye and I kind of move it, and then I come up, I hold the conjunctival sac down, and I squeeze with my fingers. Now, of course, you need gloves on to do this. Squeeze with your fingers, and then you can pop it out. Where are you going to put it? If you don't have contact lens case, you can put it in like a little specimen container cup, labeled right or left, and make sure you have saline in there. Now, I've never actually taken out hard contact lenses, but you can see the picture on how to do it. You open it up, and from what I've been told, if you put the little saline in there again, if you pull it apart, it will typically pop out more so. If you really do have a hard time getting them out, they do make little suction cups that will actually, you can take that off. But you do want to get those out, because you don't want to have scratched corneas. Okay, you don't have any corneal abrasions. So again, you would label that. Now with the hearing aid, there's different types of hearing aids, as you can see in the book. They show you different pictures of hearing aids. And how do you know if a hearing aid is working? One way you can do is you can take it out, put it in your hand, it should whistle. If it whistles, you know the battery is actually working, because the batteries run out fairly quickly. So if you take it out, put it in your hand, and it whistles, then you know it's probably right. So if it's whistling in their ear, it's not put in correctly. So it needs to stop whistling once it's in there. All right. What are some other things that you want to think about? Another thing you want to think about is when you're brushing someone's teeth. How do you brush their teeth? Well, it's important that they actually sit forward. So if you have to brush their teeth, usually it's because they're not able to take care of that need themselves, right? So if I have a bunch of water and toothpaste, and where's that going to go if I'm laying flat in the bed? If I'm laying at 45 degrees flat in the bed, what's going to happen to that water and toothpaste and all the saliva? I'm going to swallow it. And yes, do you need to brush someone's teeth if they're not able to? Yes. There's been lots of studies that correlate the incidence of not being able to have good oral care with, I'll be there in a minute, not good oral care with being able to, linked with pneumonia. So make sure you are doing good oral care. It's linked with all kinds of incidents of different diseases. So make sure that there is good oral care done. But anyway, how would you do it? First of all, you would have them you turn them to the side and you lean them slightly forward so it would drain first out of their mouth. So where it drains, instead of going back into their mouth, it's coming forward and draining out. So they're turned to the side and their bed's slightly forward. You can also, which I advise, if you have somebody who's not able to do their oral care themselves, you set up suction. And there's a thing called a Yankar. It looks like this. It would be to suction. And you could use this to help to suction out the toothpaste and the saliva as you go along. So they're brushing the teeth, you're brushing their teeth, and you're also suctioning. This also helps to keep the mouth open while you're actually doing the teeth. So I advise this. And again, you just use a soft toothbrush and you brush the teeth like you would normal. You can also, they have little sponge things, which sometimes are cooked to suction, sometimes not, but a little sponge thing where you can clean their mouth. Again, I wouldn't be using hydrogen peroxide, I would be using mouthwash, so it was half and half. Otherwise, it's very strong on the mouth, unless there was a solution that was ordered by the doctor. All right, so hopefully this will help you to kind of have just a general idea of how we're going to do it. I'm going to show you another video where I show you how to do a bed bath and an occupied bed. But make sure you're familiar with what is in the book as well. And look forward to seeing you in class. Like I said, on Wednesday we will actually just get into groups and go ahead and give a occupied bed bath and change an occupied bed. All right, so you'll do a complete bed bath for some patient. Thank you.